So gastro means stomach. Intestine, including small intestine and large intestine. So that's the problems we're talking about here. Is digestive system, including stomach, small intestine, and large intestine. So in this part, we're talking about the two illnesses. One illness is irritable bowel syndromes. Clinically, we're pretty simple to talking about IBS. It's pretty commonly illness. And another one we're talking about ulcers in the digestive systems. So that's in digestive systems. We're still talking about two illnesses. Firstly, we're talking about IBS. Yeah, IBS. Irritable bowel syndromes. So irritable bowel syndromes, basically it happens mainly in the large intestine. But maybe relationship with small intestine. So the main symptoms, abdominal pain, maybe constipations, or maybe diarrhea. And this kind of pain is usually triggered by people eating and maybe reduced after bowel movement. And certainly they may have some other symptoms like a bloating sensation in the abdominal area, or maybe nausea, and maybe some mucus in the stool. And maybe sometimes people feel not completely empty after their bowel movement. And maybe some pain in the arms and the rectum area. So that's generally symptoms relationship with IBS. So IBS is the problems relationship with digestive systems. Abdominal pain relationship with the bowel changing. So that's the main issue. So with West medicine, West medicine treat IBS. The more important part is the diet. Lifestyle changing. So that's coming from Western medicine treatment plan. Part is diet changing. And then maybe with some medication, drugs together. So if patient not changing their diet and lifestyle, medication not truly totally working there. So that's basically we treat the symptoms. Like a patient constipations, or maybe diarrhea, maybe abdominal pain, we treat to relieve it. And also some people, that kind of like a diarrhea, abdominal pain, for association, relationship with emotions. So that's we still can go to treat. So for people constipation kind of patients, more fabric, yeah, we can eat some food, more fabric kind of food, or maybe use fabric supplements. So that can help people relieve constipations. And certainly if patient more painful condition in the abdominal area, we need other medications. So relieve abdominal painful situations. And certainly for diarrhea kind of patients, we need a different medication to relieve or stop diarrhea. So that's generally say for Western medicine, the treatment mainly treat symptoms relationship. If a patient have emotion situations, we need some special medication, treat emotions and relieve stressful conditions. So generally say, is the symptoms treatment and changing the lifestyle, changing the diet habit. So for Chinese medicine, basically we're talking about 泻痛. 痛 is painful. 泻 is diarrhea. So that's painful diarrhea. Yeah, painful diarrhea. So if patient more abdominal distension, we may name it 腹胀. 腹 is abdominal area. 胀 is distension. If patient more constipations, we call 便秘. B is constipations. 便 is bowel movement. So we still by different symptoms patient have, we list the illness to different categories. So for TCM reasons cause the problems, we're still talking about some damage by internal reason is 7 emotions, or maybe some irregular kind of eating, food relationship, or maybe some lifestyle, some not to rest, yeah, and the physical activities is not suitable for the patients, and maybe caused by other treatment, use some other medications, then cause that's the problems. So even the aging, yeah, aging people still cause the problems. So we say treatment based on different patterns. So the common pattern for this illness, yeah, IBS, the common pattern, why is liver spleen disharmonized? So that's basically pretty similar, like we're talking about liver qi stagnation attacking middle jaw or attacking the spleen. So patient's symptoms, abdominal distension, and pain, and diarrhea. And the situation happens or worse when people more emotions, more stressful. And it also causes the chest pressure sensation and distension in the breast area, and maybe chest, or maybe hypochondria area. So distending kind of pain, yeah, distension kind of pain. Other symptoms: irritability, fatigue, and sometimes may be caused cold hand, cold feet. And for the female, can cause menstruations irregularly. So that's mainly we're talking about the liver qi, stagnation, attacking middle jiao. The tongue may be pale because liver qi attacking the middle jiao, attacking the spleen, cause spleen qi deficiency, and may be swollen. Spleen qi deficiency, TNT not working, water retention, cause swollen canal tongue, and the deficiency pulse mainly. So for TCM, we have a special formula treat for this kind of condition. We call 痛泻药方. 痛 is painful. 泻 is diarrhea. 药 is important. Yeah, 药 is important. 方 is the formula. So that's basically in this formula, we just have 4 herbs inside. So that's basically matching our treatment principle, soothing the liver, and tonify the spleen, and tonify qi. So in this formula, Bai shall go to the liver, soothing liver qi, tonify liver blood, and Bai Zhu go to the spleen and tonify qi. Kind of yin-yang relationship in here. And Fang Feng working for the wind condition. So they preventing external wind and internal wind. So in this kind of condition, we preventing some passenger wind coming from externally, and also relieve muscle spasm, or including intestine spasm. Yes, spasm, we can thinking about internal wind, because intestine spasm does cause painful situations. And the Chen Pi is a qi moving herb, moving qi, result like some stagnation in there. Certainly, you can modify it from here. You can add in more herbs, including patient's conditions. If patient constipation, you may add in some moistening herbs, like some seeds. Yeah, seeds. 火麻仁、玉里仁 can like treat the condition for constipation. If patient more diarrhea, you can add in more astringent herbs to stop diarrhea. So that's the formula we use for this one. And the points, the points we use. So 内关, 内关, Pacardin 6, PC6, that's the same, PC6. So PC6, we can working for the chest and the abdominal area. So that's helping with liver 3 together here, soothing the liver qi. Yeah, and moving qi go to right directions. So that's mainly can stop abdominal painful situations. And stomach 36, yeah, stomach 36, that's generally qi tonified. When liver attacking the spleen, that's cause the spleen qi deficiency. So that's basically in here. And the stomach 25 working for the large intestine. Stomach 25 we can working both for diarrhea condition and constipation condition. And also depending is deficiency condition or excessive condition. Excessive condition will reducing it. Deficiency condition will tonify it. So that's basically. And also we use 四神聪 raising some 阳气 exercise 四神聪 人 6 qi tonified and 人 9 regular some water, so harmonize the intestine. That's basically we use this formula. So acupuncture, we still can call it formula. So acupuncture formula. So means we combination with different points together. So even we don't have acupuncture formula like coming from the Asian book, but we still can combination different points together, make it a special formula. Then if a patient have more conditions like diarrhea, adding spleen 9, constipations, adding 三焦 6. And for patient have cold symptoms, we use Maxa stomach 36, and stomach 25, and 人 9, and 人 6. And if patient have heat condition, we can clear heat from stomach channel, like stomach 37 or stomach 44. And if patient have dampness condition, we still can use spleen 9. And for severe kind of spleen qi deficiency, we can go to yuan south points of the spleen and tonify it. So that's generally this condition and the formula. And also for other conditions, for food stagnations, we can add in ren 21, helping moving, and with stomach 21 together. And for kidney qi or yang deficiency, we warming 堵缝, that's 命门, yeah, that's 命门. And the kidney yin deficiency, we can go to kidney 7. Liver qi stagnation and changing to heat, we can go to liver 2. And even gallbladder 4. So we have a lot of conditions we can modify from where our originally treatment formula there. Then we talking about another pattern. So another pattern, we say spleen kidney yang deficiency pattern. So this kind of condition, patient may be more losing stool. Sometimes maybe with edema and clear urinations and still kind of abdominal painful situation, but even more diarrhea condition. And cold, cold body, cold hand, cold feet, and even can have lower back painful situation, lower back soreness, and generally weaker. Pulse is different kind of pulse. So for this kind of condition, we treatment, we need a warming, warming spleen and warming kidney yang. So if spleen yang more deficiency, thus we can use 香砂六君子. So that's spleen tonified Manley formula. So that's Manley qi tonified formula here. 党参、白术、茯苓、甘草 Let's go to the spleen tonified. So 香砂六君子 coming from our 四君子，四君子汤。So that's the 四君子汤 here. 四君子汤 here. Then plus 木香、砂仁 That's we call. So basically 香砂六君子 That's we have 6 ingredients in there. And also plus 陈皮. So that look like we have 7 ingredients here. But generally, 木香砂仁 is 7 moving herbs. Middle 交7 moving. So that's mainly tonify the spleen function. And the acupuncture treatment, acupuncture treatment. With spleen tonify, stomach 36, pretty good for stomach, spleen tonify, and also spleen 6. And the spleen 9 is result some phlegm, and the ren 4 is the tonify formula. So spleen qi deficiency, TNT not working. Sometimes it generates some body fluid or phlegm. So that's the result phlegm and the result body fluid. And especially these kind of patients, possible have edema. If patient more kidney yang deficiency, thus we use another formula, 肾气汤加味. So 肾气汤、肾气丸 basically the same. And 六味地黄丸 basically the same. 山药、山竹鱼 That's 茯苓泽泻 That's 1 肾气丸 and plus some other herbs. 桂枝、治附子 That's 金匮肾气丸 Kidney yang tonify. And then adding some herbs, promote urination and tonify the kidney. 牛膝 tonify the kidney and bring the heat go downwards. 桑寄生 kidney tonified. And we still have 杀人 qi moving go to middle jiao, and 白豆蔻 moving qi go to middle jiao, and 牡丹皮 clear some heat, 生地 still in the 肾气丸，车前子 北泻 promote urination. So that's basically we say yin yang tonified and moving or result dampness or phlegm. For acupuncture treatment, we go to back through of the kidney, tonify there, and we also still go to spleen points to tonify because that still have spleen deficiency in there, and the rainfall for generally tonify there, and the spleen still relieve some water retention. You can add in more like the points, like stomach 25, still working for the intestine, stop diarrhea. So you can more add in there for the symptoms. And the maxa, yeah, and the maxa. We can use like mainly lot of points here. We can use maxa. So that's generally we're talking about for patients IBS, yeah, patients IBS. We can use combination TCM with Western medicine together. And also we can thinking about some food therapy. Still control the food patients eating and changing the lifestyle. So we still like changing the patient's constitutions, like build up 正气. So like encourage the patients go to more exercises and more relaxing. We say that most people have the problems relationship with the emotions. So that's generally or including our treatment plan. And if patient have other symptoms, we can just according the patient's symptoms and use special kind of herbs or maybe use special kind of oils to get the treatment. So that's for the IBS.